With your dirty hand, you're controlling this little cover. Suction on, suction off. With your clean hand, you're controlling the tip. I'm going to make you cough here a little bit. Stick that right in there. This would have lubrication on the end of it. Then stick it right in there and feed it right down gently. Then apply suction. Then apply suction. And slowly pull that out. There you go. Let him recover. Give him some oxygen. He's on a ventilator right now. Odd. We're showing you the suction catheter connected to the suction tube, the suction hose. This patient here has an endotracheal tube in that goes down into their lungs. It's connected to a ventilator. This setup is an inline suction setup. As you can see, it is an elbow with a suction catheter encased in plastic so it's not contaminated, and is used over and over again on the same patient. It connects to the endotracheal tube. The elbow from the ventilator circuit is removed, and this connects to the ventilator circuit. This has an on and off button. You rotate it and push down. You rotate it and it's locked. And it connects to the suction tubing. We're going to suction you now, make you cough, get some of that secretions out. Apply suction and withdrawal. Good job. Now catch your breath. On the ventilator, we would turn it to 100% to pre-oxygenate him, post-oxygenate him, and watch for saturation and vital signs while you do that. We're showing you on this the inline suction. The inline suction elbow and the endotracheal tube connection to the ventilator. This is an endotracheal tube. As you can see, the end of it has the Murphy eye, and here we have the cuff. The cuff runs down through a tube in the middle of it to the pilot balloon. The pilot balloon is inflated with a syringe, and look at this cuff. As I pump air in it, it inflates, and this seals off the trachea so that air going down the endotracheal tube does not leak out, and we're able to deliver positive pressure ventilation that way. And we can suck out that air using our syringe and withdraw that tube when we extubate him. We're showing you here the endotracheal tube, and as you can see, this one has an ID interior diameter of 8.5, do not reuse, and markings 24, between 23 and 25 is the most common location for most patients. 24 at the teeth. 23, 21, 29 we're getting a higher and higher location. Of course, when you get up there, you're out of the airway. So 24 is down there, 25 deep, 27 deep, 27, when you're at 27 at the teeth, for the majority of all patients in America, you're at the carina. 27 is the distance to the carina. So 24 is a good location. We're showing you the endotracheal tube, and here is the endotracheal tube connector, which disconnects and comes out. This will not connect to the ventilator now, so be aware, you need this to work. The Murphy eye, the endotracheal tube cuff, the connector, the distance markings, the 8.5 size of the tube. This line right here is the radiopaque line, which shows up on x-rays so you can see how far the endotracheal tube goes down. The suction regulator. This is continuous and intermittent. On continuous, the suction is always on. On continuous, by flipping to continuous, on intermittent, it only comes on every now and then. It will turn on and apply suction. It will turn on and apply suction, and then it will turn off. And this is more for GI tract suction, where they don't want the suction tube to be sticking to the wall and causing GI bleeds. We use continuous all the time. And here, on this here, we have our regulator knob, and we can set that regulator pressure really low. So, turn your knob, take your suction hose, which is not connected to anything, and put your finger over it, and it will come up to its high level. Here we're coming up to 100. That's where you want to stop when you're suctioning for children. 80, 50, 60, 70, 80, 80 to 100 for children. And for adults, 100 to 120. So here we're kind of too low, so we just turn this, release your pressure, and turn it up a little bit. 110, 120. Now we're at 120. I need more. Turn it up, 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 150. That's how you check your suction. Let's turn this off now using the on and off knob. Very good. So the question is, how much suction do you use for an adult? The suction pressure is 100 to 120, and it is in millimeters of mercury. This is a small little portable suction device, and here we have our suction tube coming in. It goes to the machine, the compressor, and here is a gauge reading what our vacuum is there. And on the back is the on and off switch. We will sometimes carry these around to the patient's room where they may not have suction available and use this at bedside. The portable suction device.